So one of the most common referrals I get is for shoulder pain related to your rotator cuff. Now, rotator cuff tears are really common, like super common. About 1 in 4 people over 25 have a rotator cuff tear, full thickness. And by the time you're 70, it's about 1 in 3. Sounds bad, right? But what if I told you that 70% of those tears are asymptomatic? Which means that you are more likely to have a rotator cuff tear without pain than you are to have a passport. So what do we do with that information? Well, as a physical therapist, it's my job to determine one of 3 things. Number 1, is your shoulder pain actually coming from your shoulder? Studies show that 50% of shoulder pain is actually referred from the cervical spine. Number 2, if it is your shoulder, is it actually your rotator cuff? Once I've ruled out your cervical spine, then we will look at the shoulder itself to determine if your pain is coming from the joint or if it's coming from the muscles of the rotator cuff. And number 3, if it is your rotator cuff, can it be managed with physical therapy and exercise, or does it require surgery? Most studies show that non-traumatic rotator cuff tears do better when managed conservatively than surgically. Unfortunately, there will be a small percentage of people that do not respond to physical therapy. If that is the case, it's my job to send you for a surgical consult. So, if you are struggling with shoulder pain and someone is recommending surgery without first attempting physical therapy, or you're currently getting treatment and your therapist has not addressed your cervical spine, then you may need a second opinion. Cheers.